Susan Spratt, Duke endocrinologist. When you have diabetes, you have to prepare ahead of time for when you might become sick. I'm here with dietitian Ileana Vink and pharmacist Patrick Gregory. Ileana, what do you need to have on hand in case you become sick?
So here is a list of foods that it is helpful to have on hand to help you stay hydrated and prevent problems like high or low blood sugar if you can't eat or drink like you normally do. Foods that may help you stay hydrated include things like sugar-free gelatin, ice pops, sports drinks, or juice, canned clear broth soups like chicken broth or vegetable broth. And it's good to have foods that are easy to digest that provide carbohydrates in case you're not able to keep down regular food. Examples of these foods include crackers, toast, applesauce, pudding, oatmeal, or grits. It's good to have drinks with no sugar in them, like water or diet soda. And it's also good to have drinks that do have sugar in them, like regular soda or juice, in case you have a low blood sugar.
Ileana, thank you so much. Those are very helpful suggestions. So Patrick, what about over-the-counter medications and other supplies that you should have on hand?
Thanks, Susan. That's a great question for patients. So it might be helpful to keep some medicine and other items in your home since when you're sick, you may not be able to go out and get them. So some of these could include things like pain relievers like Tylenol or Motrin, otherwise known as ibuprofen, medicines to control things like diarrhea or to prevent heartburn, urine ketone strips if your provider has recommended them, and then also something as simple as a thermometer.
Patrick, I think a lot of people might be scared to take their typical prescribed medications when they are sick. What can you tell them about that?
Thanks, Susan. It's a really good question. What I would probably tell most patients is to work with your provider to form a sick day plan. Your plan will depend on what type of diabetes you have and whether you are on insulin. You should definitely check your blood sugar more often. When you are sick, your blood sugar can go low if you are not able to eat enough or if you're vomiting or have diarrhea. But your blood sugar can also go high from stress on your body or some medicines that can raise blood sugar. The only way to know what your blood sugar is doing is to check it. Be sure to take your insulin and diabetes medicines as usual. However, there are certain reasons you may need to change when or how you take them. If you cannot eat and take a mealtime insulin with food, these mealtime insulins could include things like Humalog, Novolog, and Apidra, and please don't take your insulin. Talk with your provider about how you should handle high blood sugars. Check your urine ketones. If the urine test strip reads moderate or high, go to the emergency room. If you are on a type of medicine called an SGLT2 inhibitor, these include medications like Invokana, Farxiga, and Jardiance. Do not take them when you are sick.
Thanks, Patrick. That's really important information. So what about symptoms that patients should watch out for that might cause them to need to go to the emergency room or be admitted to the hospital?
Yeah, I think this is something that most patients really need to know. And so if you're vomiting, if you're having diarrhea or urinating a lot more than normal, you can get dehydrated. One way to tell if you have enough fluid in your body is to look at your urine. Healthy urine is pale yellow, kind of like lemonade. If your urine starts to get dark like apple juice, that is a sign of dehydration. Dehydration might also cause your lips to get dry or cause you to have a headache. To stay hydrated, drink fluids. Even drinking slowly can prevent dehydration. You can also have foods that provide water, like ice pops or applesauce.
Keep in mind, you can still have high blood sugar even if you cannot eat. Your liver can make sugar even when you do not eat.
Yeah, good point. One major risk of getting sick when you have diabetes is developing something called diabetic ketoacidosis, or DKA. So DKA happens more often to people who have type 1 diabetes. It happens when your body does not have enough insulin. Without insulin, your body can't use the blood sugar for fuel. So instead, it starts to use fat. When your body uses fat, it makes a substance called ketones. When there are too many ketones in your blood, it can make your body too acidic, which may make you dangerously sick. DKA is definitely a medical emergency and needs care right away. To prevent DKA, keep taking your long-acting insulin.
Thanks, Patrick. And along with taking your insulin, your food and your insulin can work together. If you are able to eat while you are sick, keep taking your mealtime insulin. Foods like crackers, oatmeal, or toast provide carbohydrates for fuel and are easy to digest. If you cannot eat solid food, you can still take your mealtime insulin if you are able to have drinks, liquids that have carbohydrates, such as regular soda, juice, or a sports drink. Talk with your provider if you should take a different dose of mealtime insulin for those smaller amounts of carbohydrates.
Remember to go to the emergency room if you have any of the following symptoms: trouble breathing, if you can't keep liquids down because you're vomiting for more than 4 hours, your blood sugar is lower than 60 and you can't keep food or drink down to get it up, you feel sleepy or you're not thinking clearly, you lose 5 or more pounds within a day, or you have vomiting or severe diarrhea for more than 6 hours.